So this is my continuation of interventions and services. So the area agency on aging services are provided geographically, and they focus on planning and service areas, which are managed by a city, county, or multi-county district. So local areas, agencies on aging, um, are referred to as planning and service areas. And there's a link below that provides you with some information about the local area agencies on aging. You can locate resources in your area through this link. As far as meso improvements and interventions, area agencies on aging provide communities with education and training, public awareness prevention, and participation in multidisciplinary teams. Services can be improved through continued research to determine best practices to serve communities. At the micro level, social workers should complete accurate assessment of clients' needs and resources available to address their needs. So assessment is critical in the delivery of services through Adult Protective Service because they use this information to formulate interventions, practices, and policies. At the macro level, social workers should continue to advocate for federal funding programs to improve these services. Another intervention that's well known is respite care, and there's a National Family Caregiver Support Program. The NFSP provides funding to states for assistance to caregivers who provide in-home assistance to the elderly. The Caregiver Respite Program allows primary caregivers to take a break so they can focus on self-care. Families can hire trained caregivers, utilize adult daycare centers or nursing home facilities to care for elderly family members. This program is managed through your local area agency on aging. So this program is implemented to mitigate some of the caregiver stress so they can address their own needs. There's a link below associated with the National Family Caregiver Support Program where you can find your local area on agency that provides funding for respite care. On the macro level, social workers need to be aware of how policies and funding impact the service delivery and should continue to advocate for elder justice, research, and evaluation of policies and practices. Little is known about what constitutes caregiver stress, and little is known about the perpetrators of elder abuse because it's fairly new research and research is still being conducted. So, social workers need to be advocates for change. At the meso level, social workers can work with communities to increase awareness and so they can access respite services. They can participate in coalitions and conduct public awareness campaigns and also evaluating current respite programs. So those are some ways that social workers can engage at the meso level. At the micro level, family assessment is important, providing accurate information, providing families with resources, providing training to caretakers. A lot of caretakers need counseling to mitigate the stress and assisting the elderly in securing services. So the primary thing for social workers at the micro level is still assessment because they need to compile data so they can evaluate it and make determinations of what are the best evidence-based practices in respite care and in other areas associated with elder abuse. There's also a public guardianship program. Um, when there is no one willing or acceptable to act as a guardian for an adult, maybe their caregiver was not related to them, maybe they came from an agency, and so they might not have family that they can turn to. So what happens is the probate court determines that the person, the elderly individual, lacks sufficient capacity to make or communicate significant responsible decisions concerning their own health or safety. So these people are usually incapacitated. So what happens is DHS may appoint a guardian as a last resort. So I found some information about the guardianship program in my state because they differ from state to state. So if you want to learn about the Pennsylvania courts programs to deal with guardianship in Pennsylvania, you can click on the link below. At the macro level, there is a need for guardianship data as states have not reported accurate information. So every state is, like I said, they're different. Securing reliable data will help policymakers make informed decisions about guardianship. Because guardianship is not without controversy, there have also been reports of guardians who misuse the elders' financial resources. So a lot of guardianship programs have issues with financial exploitation, especially if the guardian is not part of an agency. There are some agencies that have guardianship programs where they have social workers who oversee the care of the elderly. At the micro level, social workers complete assessments of the elderly for court hearings and providers of guardianship services. Social workers need to collect thorough assessments. Assessments is heavily relied upon in the area of elder abuse because, like I said, they need to obtain that data. At the meso level, there's a multidisciplinary approach which involves the courts, social services, adult protective services, sometimes the local area on aging agencies are separate. Social workers should encourage collaboration to advance theory and practice in elder abuse and in guardianship. There's also the National Adult Maltreatment Reporting System. This is important. It's called NARMS. NARMS is the first reporting system for adult protective services. The purpose of NARMS is to provide evidence-based research data on the exploitation and abuse of older adults and adults with disabilities, as reported to adult protective service agencies. There's a link to the NARMS system, and at the macro level, NARMS was created to provide accurate national information to inform adult protective service practices. Information is compiled from data on elder abuse and adults with disabilities. At the meso level, states, area agencies on aging, adult protective services, social services, and criminal justice organizations need to collaborate to ensure quantitative and qualitative research methods advance the research of elder abuse to inform prevention, intervention practices, and policies. So this is still an emerging area. They're still compiling data. At the micro level, social worker and members of multidisciplinary teams need to ensure accurate data collection and need to know how their inquiry will translate into building knowledge concerning data on client characteristics and perpetrator characteristics and services. Another approach is the multidisciplinary team. Multidisciplinary teams were created in 1980 to address elder abuse. They use a variety of service providers. As I mentioned before, it was adult protective services, long-term care, ombudsman, law enforcement, city council, county council, and nonprofits, and occasionally for-profit agencies that provide service to community resources, advices for protective services, and advice and new perspectives during case reviews. The multidisciplinary team is at the meso level. There's limited empirical support for the effectiveness of multidisciplinary teams, which indicates the need for continued research and overall effectiveness. So, social workers need to engage in evidence based research practice, and by advancing the research efforts in multidisciplinary teams, they will find what are the best practices to provide services to the elderly population. And finally, we have the long-term care ombudsman program. This is when trained volunteers advocate for residents of nursing homes, assisted living facilities, board and care homes, and similar adult care homes. The long-term care ombudsman provides information about how to find a facility and what to do to get quality care, and they are trained to resolve problems. The majority of complaints are related to issues involving inadequate care, abuse, neglect, or exploitation, especially financial. So there's a link below to the National Ombudsman Program where you can get more information. This program at the meso and micro level of social work is an area where social workers can promote and participate in state and local abuse prevention task force, as well as evaluate proposed policies, regulations, and laws enacted to support consumer protections and to strengthen protection for older adults. At the micro level, social workers should respond to the elderly's concern over quality care and provide the elderly with education concerning their legal rights. Conclusion: elder abuse continues to be a problem that has severe consequences for the elderly. There is limited empirical information about effective interventions. Current knowledge indicates that evidence-based practices include the use of assessment instruments, case management, and structured decision-making models. However, social workers need to participate in research to test the effectiveness in reporting, investigating, preventing, and intervening on behalf of the elderly impacted by abuse and neglect. Macro-level policies provide federal funding through the Elder Justice Act to encourage research and provide guidance at the practice and policy level. Social workers will be instrumental in future research development because they directly intervene with the elderly. Social work practice can improve the response to elder abuse by addressing policy changes at the macro and meso level. Finally, social workers can improve the response to elder maltreatment by advocating for a national definition of elder abuse, collaboration with other professionals to improve the interdisciplinary delivery systems coordination, and by conducting research on cultural influence concerning elder abuse. And finally, by creating campaigns to increase public awareness about elder abuse and neglect.